So good evening to one and all present here. Today we are going to discuss with ma'am about various strategies, certain important tips and tricks to master your preparation in the NEET MDS. So ma'am, in a busy schedule, has accepted to do a live, and I feel so blessed and thankful to you, ma'am, for joining us in this live session.
I feel the
Thank
same.
you
Thank
very
you.
much, ma'am. Thank you very much, ma'am. It's indeed a pleasure to interact with you through this social media to know much more so that we can intensify our preparations and we'll be able to crack the NEET MDS, ma'am.
I'm
Thank
very
you so
glad.
much for joining. Thank you very much, ma'am, for joining this live.
It's my
Ma'am, I
pleasure,
think we can
and
start.
I would love to share my knowledge with students who are working so hard for NEET MDS.
Yes, ma'am. So it's a big question for all the undergraduates, including me. What will be the next for the after the BDS?
Right.
So I think our session today will be enlightening most of us. Like we are just very blank. I don't know when the exams are going to be, when the results are going to come, and nothing we know, ma'am.
Yes.
So I think your important tips and tricks and some strategies of yours will help us a lot in preparations and also mastering and cracking the NEET exams.
Definitely. I'm helping how much ever we can help.
Thank you very much, ma'am. So with this, let's start our session today. So as we all know, today we have our eminent speaker, Dr. Noor Saira from ma'am from Bangalore, who is an ambitious endodontist, and she has a very impressive track record with almost 11 gold medals and 30 awards to her credit. Most recently, she has been awarded with the prestigious Rising Star Clinical Excellence Award by the Indian Association of Conservative Dentistry and Endodontics. So today our session is going to completely focus on the tips and tricks, as I was telling you before, and so that to master our preparations in the NEET MDS, and also so to crack a better rank than 2, that is almost rank 1. So our target should be rank 1. That's what ma'am is going to emphasize today. So with that, we can start our journey today. So ma'am, to start our live session today, so could you just tell us about your journey, ma'am? So how was it, and how did you do the preparations, and so what was the driving force for you to get rank 2, ma'am? So could you it'll be a pleasure if you talk something about that.
First of all, thank you so much for this wonderful introduction, Jude. And I would like to say thank you for inviting me, and I'm very glad here today to share my experience and to give some best practices for the students. And as far as my journey is concerned, I finished my BDS in the year 2012, and from Ambedkar Medical College, and I have about 11 gold medals, like you said, and have multiple awards to my credit. And this is only because I worked hard every single year, and I had an aim of what I wanted to achieve at the end of 5 years. And I ended up topping every year in almost every subject. And once I finished my final year BDS exam, I took about like 10 days break. And I know it was very crazy, but I started preparing for my entrance exam then and there. And I had about like 13 months in hand to prepare for it. So I started preparing consistently and determinedly for about 7 to 8 hours every day. And then even when internship started, I made it a point to even study in college. And even during my internship, I made sure I studied for about 8 to 9 hours or 7 to 8 hours every day. And this went on for about 13 months. And finally gave the exam with a lot of hard work. And one day I was just sitting in my canteen attending my internship, and my brother calls me up and he says, slap yourself. And I said, why? He said, Times of India has called to take an interview of you because you have a Comet K rank 2 at that time. So I was shocked that so much hard work actually paid off, because I had not had any entertainment for that 1 year. No movies, no friends, nothing, because I was just dedicatedly studying every hour. But I was very focused on what I wanted to do in life. So I was very glad to so much of hard work, especially to my father who kept motivating me to study. I was very thankful to Almighty, and also I am very, very thankful to my teachers, because the day I got my results, I had 4 months of internship pending, and they helped me clear it because I had a rank. They said they nullified it because I could go attend my counseling and get my seat. And from there, I joined in NDS in Aeronautics in BSW College, and I finished it in 2015. After which, like rightly like how you said, I got my other two awards of for excellence. One is from Indian Association of Conservative Dentistry and Aeronautics, and also one from Camden recently as a budding dentist award. And now I do a lot of clinical practice. I also train general practitioners as well as along with that, I do a lot of editorial work, a lot of international publications. I have a book named Biomechanics and Restorative Dentistry. Also, one of my chapters called Geoma has been published in a book called Top 10 Contributions in Dentistry. And also, I YouTube these days a channel called as Dentistry with Noor Saira, where I put simplified lectures to students who are finding it difficult during this lockdown. I'm also planning to come up with a website wherein I'll be providing complete lectures on certain subjects, especially basic subjects, which a lot of students find it very, very difficult to study for entrance exams. And this will be associated with a lot of MCQs to support with so that they have a better understanding. So, having said that, let's begin with the main topic today.
Yeah, I'm sure. Actually, your story was very inspiring personally to me, ma'am. So it was really inspiring. You know, you had a lot of sacrifice. No, you just was totally oriented towards your goal of achieving ranks and medals and awards, and you just wanted to put in all your effort. And with God's grace, you excelled very well, ma'am. That was very inspiring, actually, to take your journey.
Thank you.
Many, I think, not only to me, many of the people who are attending the live also it'll be a true inspirational story for them also.
I hope they get motivated.
Thank you so much for
and they take some message.
Yeah, ma'am. Yeah, yes, ma'am. So the next question, ma'am. So once we finish our final year and we get into internship, so the next thing we do is start preparing for the NEET MDS. So the first book which comes into our mind will be the Dental Pulse. And now it's come into 3 volumes almost, covering almost the 19 subjects. The recent volume, 13th volume has come, and costing around some 4,500, and we never hesitate to buy that book. So only is Dental Pulse is enough for our preparations, or how, ma'am? Should we refer any other books to do our preparations? And how should we go about the preparations, ma'am? So if you could tell something about that, it'll be helpful for us.
See, the answer for this question, that if Dental Pulse is enough, is that it is yes and no at the same time. Now, this answer is because Dental Pulse gives a complete idea about what to study. So basically, NEET MDS is expecting 2 things from you. One is that you complete your syllabus. And to complete the syllabus, Dental Pulse is enough. That is, if you study the entire Dental Pulse, you have an idea of which topic to study in which subject. But that topic from that subject has to be studied in more detail from a textbook or a material that you have to build up more concepts on that topic. So if you're building up your concepts from a textbook, then Dental Pulse is enough. But if you say you're going to study only Dental Pulse, then it is not enough. So Dental Pulse has to be used like where you get all the topics in an aggregate, and you're able to know the synopsis well. And that synopsis, the topics in the synopsis, the topics in the question, you go back and read it in detail from a textbook and build up your concepts well, then Dental Pulse is enough. So 2 things in NEET MDS. One is that you need to know the entire syllabus. You cannot leave out any topic. You cannot say that has more weightage or that has more weightage, because one secret for NEET MDS or any dental entrance exam question for that matter is to know the concepts well, especially the basic concepts. This is where most of the people lag. They read a lot of clinical subjects and they don't give importance to basics, but basics is equally important, and that is one of the tiebreakers that you have or brings you more forward in your ranking, the basic subjects. So it's important that you read Dental Pulse completely, but also build up your concepts from the textbook. Then Dental Pulse is enough.
So we should go about the textbooks also, ma'am. Like as you rightly said, so we should be reading the textbooks. We should go through whatever we read, because in the textbooks when we were preparing for our university exams in the first, second, and third and final years, so we would have taken up some key points. So should we be referring that also, ma'am? So will that be also helpful?
Will that be also
going through all
helpful?
those?
Yes, because it's important
Yeah.
to make
So
notes. If you have made your notes already, that is also very helpful.
okay, ma'am. So we should. So how much time should we take, ma'am? So there are almost 3 volumes in the Dental Pulse. So like, what is the right time to start the preparations, and how should we go about the preparations, ma'am? If you can tell
The right
something about
time
that,
to start
that'll
the
be.
preparation ideally would be that you need to at least have 10 months in hand. That's
Okay.
how I prepare. But since now we have only about, expecting that the exam is in December end or January 1st, we roughly have about 4 months, for 4.5 months, which gives us about, say, 16 to 17 weeks in hand. So the most
Yeah.
effective way right now to read Dental Pulse is that if anybody is starting right now, is that they read the synopsis first. They go ahead and get an idea of what topics are present in the synopsis. The same day they solve the questions of that synopsis. They mark the questions that they do not understand, read the explanation given in the pulse, and the same day go back and complete the textbook material of that subject. This is the first thing that you would do. Second thing, if you're finding textbook material too energy exhausting, or if it's too dry for you to read, now a lot of online videos are available, which has a very good material. Because what happens reading with textbook, not all textbooks give you all the information in one place, at least not the important questions. So you read these, watch these kind of videos which have an aggregate of all the information in one place. It's a smart study plan because you're saving time and your mind is also not getting exhausted when you're trying to read it. Another important thing that you need to do is make notes. You have to make notes now. You cannot make notes after 2 months. After 2 months, it's only core revision. So whatever notes you want to make right now, you pick up the tougher topics now, pick up the tougher subjects now, make a lot of notes, because people keep asking me what is the best book to study. The best book to study is your own notes, because that imprints in your mind as a mental picture. So you make a lot of notes on that. And then you go ahead and whatever topic you're finishing right now, you go ahead and revise it next week from your notes. You give a break of about 2 or 3 weeks and you revise it again from your notes. And you mark the questions that you have found difficult in dental pulse and you revise those questions again and again. Because what happens is the first time the concept, when it goes wrong, it is a human tendency that you will go wrong again after 2 months or after 2 weeks or after 3 or 4 weeks. So it's important to revise it again and again till that concept is completely framed in your mind. So these are some effective ways of how you can study dental pulse if you're initiating dental pulse. But if you're somebody who's already finished dental pulse once and you're going in and you're taking this time as a revision period, or you're taking this time as you just want to improve onto your knowledge, then you can also go on to different books. Like you have in-depth knowledge about other subjects, like you have Sparshita for pharmacology, you have Arvind Arora, you have Mudit Kanu. You can prefer these books and build up more knowledge. But whatever extra study or extra information that you have to gain is now in the next 2 months only. Because the 2 months after this is going to be core revision.
So like how many questions should be solving, ma'am, per day? So if you take a dental pulse for the freshly starting preparation, no? Like people who have started freshly. So per day, how much should they solve? Like how many subjects
So
should they
when I
cover?
was doing my preparation, I remember someone telling me that they used to solve about 300 to 500 questions in a day. So I got really inspired and I went back and I tried solving 300 questions in a day. I tried 4 or 5 times. I could not do it. So how many questions you need to solve in a day is a very wrong question, I feel personally, because everybody has a very different capacity and everybody has a very different way of learning. So on an average, if you are solving 150 questions to 200 questions in a day, along with quality development of concepts and just not quantitative increase in the number of questions. So I would say the quality preparation is much, much better for you, because that will create a long-term memory during the exam, rather than just answering questions and going on and not registering that in your mind. It doesn't make sense to me. So my way of preparation is you do at least 150 to 200 questions, but you know what you're doing. You remember that for a long time. Because even if you do 200 questions a day, in the next 120 days, that is 4 months, you're easily solving 24,000 questions, which is a huge thing. So if you're doing 24,000 questions in a quantitative way, I think that's enough to crack a good rank in the exam.
Yeah, ma'am, exactly. That's what. So you are just enlightening on like the basics plays a very important role, and continuous revisions. So these things you are telling, that's very important. These two are the factors like we should keep emphasizing ourselves.
Yes, clinical subjects is important. Basics is also important. So what majority of the people think is clinical is more important. It is nothing like that. Everything is important. There is no specific weightage of anything. There might be, but the tiebreaker that actually happens is from the basics, and especially when you read the textbook of the basics. Because not many people read it, and that's where they lag the ranks. And the person who reads it is the one who actually cracked the rank.
So that makes the difference, ma'am, actually.
That makes a difference, yes.
Yeah, yeah. So ma'am, so we have 19 subjects total.
Right.
So for each subject, how should we like split up the days, ma'am? So how should we go about the days split up? Like for pharmacology,
right
these
now,
many days you should complete it.
Talking right now, we have roughly about 16 to 17 weeks.
Yes, ma'am, 16 to
Okay.
17 weeks.
And we need at least 3 revisions of 25 to get a good rank.
Yes, ma'am.
Okay. And for any human mind, for that matter, to register the information and reproduce it, you need at least 3 or 4 revisions for anything. Nobody has a superhuman mind, right? Okay. So my plan would be that you divide this 16 to 17 weeks into 3 phases. The first phase is 12 weeks, followed by another 2 weeks and 2 weeks. That's 3 revisions. So the first 12 weeks, you're going to divide your day into 2 phases. That is the 30% and 70% concept. The first 30% of the day, when your mind is really fresh and you're not exhausted, you will read the basic subjects and try to complete your basic subject. And in the evening or in the late afternoon to evening, that 70% of the time, you will read your clinical subjects. Because clinical subjects you would have recently read and it's more refreshing in your mind. Unlike the basics, you need to put in a little more hard work and it's more dry. So you need the morning hours to study. So you're doing 2 subjects in a day. So ideally, you should complete your subjects in about 10 weeks. But keeping a 2-week buffer, that is 12 weeks, you should be completing your first revision of Dental Pulse along with the textbook. But the trick here is, whatever subjects you're reading in the first 5 weeks, make sure you're picking up the tougher subjects. And you make a lot of notes on those subjects. Because these notes are going to be your revision Bible in the end. And you're going to save so much amount of time in the end. And also these subjects will be the subjects you need a lot of revision to register in your mind. So the next 5 weeks, you will pick up slightly easier subjects and finish them off. Subjects which you think you can remember for a longer time. So this is how you will complete the first 12 weeks. And when you're preparing for the first 12 weeks, you're going to mark all the questions with a circle or with a highlighter wherever you're going wrong. Right. Now, at the end of first 5 weeks and the beginning of the next 5 weeks, you will start revision of these subjects that you finish. That is, you're going to take half an hour every morning. And you will revise the notes and the questions that you have just marked. And you will correct your concepts again and again in the mind for the harder subjects. So you are studying new subjects and revising the old subjects also.
So it should be like that, ma'am. So
it should be like that, yes. And when you finish your 12th week and you have another 4 weeks remaining, it's time when you go ahead and start with your second revision. The second revision, you will do all the MCQs again. You will do your synopsis again, and you will do only your notes. There's no time to do your textbook material or any videos anymore.
Yeah.
So this is your second revision. And the third revision, you will do only the marked questions, the synopsis, and your notes. Because the last 2 weeks, it's very important that you reduce your study hours, that you reduce it to at least 5 to 6 hours. Because here is when you will start training your mind to relax and decloud your mind and detoxify your mind, because you need more relaxed and open mind and declouded mind to recollect whatever you have studied in the last 5, 6 months or 7, 8 months, because long-term memory definitely works, and for that long-term memory to work, you need to have a declouded mind. So the last 2 weeks, only the circled or the marked questions where you have frequently gone wrong, synopsis, and your notes. Not touching anything new. Don't talk to your friends who are telling you, I'm doing this, I'm doing that, I'm reading this book, I'm reading that book. Not required. No, just focus, and whatever limited thing you have, try to revise it again and again, again and again, again and again. That's all about it. That's the one that will make the difference.
Ma'am, some people actually, ma'am, I have heard people saying like they prepare for their preparation will be completely based on clinical, and that some people will be going for non-clinical, and some preparations will be based on a merit seat, and some preparations will be based on a payment seat. So, what is your opinion on that, ma'am? So, how should we look at all those, or I don't? So, what is your opinion?
It is personal. It's a personal thing. I did not have the facility to go for a management seat, so I had to work hard, and I had to get a rank to get a seat. So the multiple factors that you have to look into, like I said. So that's one of the factors. Is it depends on what you want. But if you're talking on a rank perspective and clinical and non-clinical subjects, then you have to study both the subjects. There is nothing much you can do. But if you're talking about what kind of seat you want to get in the exam, and depending upon the ranking that you want to do, the first 100 is, or the first 100 or first 500 are the people who actually get into the clinical seats. So if you want a really good college, and if you want to be in a position where you want to select the college or the environment, then you have to be in the first 100.
So first 100 seats only they'll be getting in merit.
You'll be able to choose only in the first 100. You have the liberty to choose, basically. Otherwise, then you have a compromise to make.
After that, the competition rises. So
it does, and availability also goes down. Your choice is not very. It's not a lot.
So apart from hard work and all those, what else do we need, ma'am?
Apart from hard work, what you need is, especially during this lockdown, is that you need to keep a very positive energy, and that's one thing. Second thing, whether the exam is happening or not happening in December or in January, I don't think students should really think about it, or that whether it's happening or not, because ultimately, if you prepare now, you will write an exam. And even if you don't have the exam, you're having an extra hand in preparing and making your life easy for the next year. So you rather prepare for it rather than sitting idle and just getting confused and saying, I don't know what to do with my life and I do not know what's going to happen. Be focused, be more oriented, study well, keep positive. Don't talk a lot to friends about this topic, because I think everybody has a very different way of dealing with it, and everybody tends to talk a lot and you get confused in the end about what you want to do. But have your aim clear in life and be focused. Nobody, no matter what anybody tells you, do what you have to do. Be very clear in what you have to do. So you keep doing it. That's all. Like they say, all is well. You have to fool your mind to say it's all well. And you keep studying, keep fooling your mind, keep positive. Don't have negative energy, don't have negative thoughts. So it all be cool.
Yeah, ma'am, rightly said. Actually, we need a lot of positive energy and a lot of motivation at this time.
Yes. You need to follow.
There are a lot of people to degrade us, ma'am.
A lot of
Yeah,
people.
there are actually a lot of people to degrade as this dentistry, no scope. Please don't do MDS. 5 years you're wasted in spending a lot of money on instruments, that, this, and again you want to spend 3 years doing your masters. And now people are like very degrading us. Don't do that. Like this, that. There are a lot of people to talk about dentistry, ma'am. To degrade dentistry to the core.
No, there's lots you
Like
can do
our
after
younger.
MDS.
Yeah, ma'am. They don't see the other world actually. Like, you have a lot to shine after MDS,
So you
and
need
you
to
can
have
come
a
up really
filter
well.
to
And
keep
you're
in
a
your mind.
standing example.
Yeah, keep a filter of what you
Yeah,
take inside this.
and you're a standing example today. So I think
Thank you.
you are the right person to talk about all this, ma'am.
Thank you.
Like the revision strategies. So how effectively can they do, ma'am, during this lockdown? So we have ample time. Seriously, we have a lot of ample time, and we spend a lot
Honestly,
of time watching movies.
if the exam is in December, there's no ample time. They really need to put
Yeah,
in a
ma'am.
lot.
We are not
They need,
sure.
yeah,
Yeah.
yeah. So if it is in December, for example, we at least need to invest about 10 to 11 hours in a day. And if there's somebody who is doing the second revision right now, maybe I would suggest that they go ahead and use one or two extra books like Sparsh Gupta or Arvind Arora, provided you already have a plan that by the end of 4 months you'll be done with your pulse 3 or 5 times. But if you think you will not be able to finish your pulse 3 or 5 times and textbook at least once by the end of 4 months, then please do not touch any other textbook. Minimal requirement is pulse and textbook. If you have finished your pulse 3 or 4 times, then go ahead with other high funda books like Sparsh Gupta and everything else. Please listen to this advice because I know when I was preparing for my exams, I had a lot of friends who were doing a lot of books. They were doing Sparsh Gupta, they were doing NBTE, national boards, everything they were doing. But ultimately, in the end, what happened was your mind can't remember so much, can't remember so much information. So only what you revise consistently and determinedly is what you will remember. So revision is the key. There is no other alternative to it. So you need to be smart and invest in more time in doing a more quality oriented revision work than a more quantity oriented work. Okay, so that 24,000 questions that you're doing, if you do it really well and revise it again and again, that will produce a much better result than doing 50,000 questions and not remembering any of them.
Ma'am, so while revising, they'll mostly be solving the question papers, ma'am. So if they go wrong with some questions, so how do they rectify that, ma'am?
So what I would
like, should
suggest
they go
is,
back to the concepts? Yeah.
you study for 6 days, that is Monday to Saturday. Sunday early morning, you take a mock exam. Okay, and you close the book. Sunday is a rest day, basically. You need to detoxify your mind one day. It's okay because you need your mind to remember, recollect things, and you make a long-term memory. Monday morning, you will get up, see the questions that you've gone wrong, keep a small notebook, write down the topics of wherever you're going wrong, which concepts you need to rectify. And you finish off one concept one day. And that way you're covering and revising.
So it should be like that, ma'am. So
it should be like
should be seeing both.
Yes.
And while revising, should they catch up with new concepts? So if they would have left some concepts,
yes, why not? Yes, why
is
not?
it good to catch up with concepts?
Like I said, it's very important. At least if you know what has been asked in the dental pulse, it's very important. So first, for example, let me give you an example. You're reading about lichen planners or you're reading about leukoplakia. In the first revision, you might not pick up the female to male ratio of lichen planus, or you may not pick up the female to male ratio of leukoplakia. We know that there is a very high predilection to male in leukoplakia, but we don't know the ratio. We can't remember it so well. So maybe in the third revision or in the second revision, when you know that leukoplakia is more common in male, we know what the types are. Now it's time to upgrade your information a little bit to the ratio. Because ratios are being asked in the dental entrance exam. And not everybody remembers it. And the person who remembers it and marks the answer is the one who is going one step ahead. There's where the revision actually makes the difference. So the more you revise, the more you're upgrading your knowledge into more information about the same topic. So like I said, if you have finished your dental pulse completely thoroughly, then upgrade the knowledge.
You can just add on to the concepts you already
add
know.
on to the concept.
Like
It
that.
depends on where
Add on,
stage you are basically.
Yeah. So if you're lacking in something, you can just refresh
Yes,
with the new
always,
concepts,
always.
and
Yes.
it's like
Make sure that you at least keep half an hour every day for revision. Every day.
so we should be in touch with all the subjects, ma'am. As you say, like we shouldn't leave any subject like we have finished. Some people will have overconfidence. Like I've finished. I'm thorough in general surgery. I'm thorough in pharmacology. I'm thorough in conservative dentistry. So that should not be the attitude, ma'am. So what do you say about
It's a
that?
very good attitude to have.
Overconfidence.
Confidence is good. It's very good. But being overconfident, it does harm you sometimes because mind does not work like that. No matter how good you are, how brainy you are, your mind does not function like that. So the mind is made in a way that you have to constantly revise everything. It's only then it gets registered in the mind. Because this is one category of people. I belong to the category of people which I always said I never remember anything. I never remember anything. So even during my end of the preparation, I was like, I don't think I'll be able to perform well because I don't remember anything. But revision does work, and that's the only thing that will work. So when you keep your mind calm and you're cool, and you go ahead and write the exam, you will definitely have a long-term memory that will come back again.
And mnemonics also will play a very important role. Like,
Yes,
from
mnemonics
the
do help.
keynotes, mnemonics.
Those
So
are
we need to take
memorization
mnemonics, man.
techniques.
That's
Yes.
the way we remember stuffs, man. Like
Yes.
pharmacology, certain adverse drug effects. I think if you go away, like in the preparation with mnemonics, I think it will be a little bit helpful
Like
for
I
us.
said in one of my
So we
YouTube
might
videos,
remember.
it's one of the memorization techniques. So you
Yeah,
draw a lot of flow charts when for example, if you're learning anything about an artery or if you're learning anything about a nerve, make sure you just start writing it. You make a flow chart. So this flow chart will become an image in the mind, and that's called as a memory picture. And that's how it will come forward when you're writing the exam as well. And mnemonics apart from
ma'am,
it.
and another question, ma'am. So, like while we are answering, ma'am. So, if you don't, if like we're writing when we're writing the NEET examinations. So, if you're not sure with an answer, so should we go for a guess or should we just leave it? So, there's negative marking, ma'am. Like
There's one
in the
for
NEET
negative marking,
examinations.
yes.
Yeah, so it will be affecting a rank. Like if you answer all the questions, we'll surely not be knowing all the answers, no, ma'am. All the answers, which like all the answers to the questions. So how should we do that, ma'am?
So what I would suggest
Like
is,
we're answering.
I'm planning to come up with a video on this basically because there is a way how you can answer this, because I understand that NEET MDS right now also has some image-based questions. So they give you an image and you have to identify. Now there's some tricks and tips which you can apply there, and maybe we can make a video now. That will be a better way to answer this question.
Yeah, soon you'll be uploading in your
Yes,
YouTube channel,
yes.
ma'am. So, yeah. So they were like, we'll see the questions, ma'am. There were two questions being asked. So they were asking like, what is the right time to start the preparations? So
The
that
right
was the
time is
question,
now.
ma'am.
Start
So
now. Start today. Start today.
yeah, so
There
starting
is never
today.
a right time.
And like how
Start
many
now.
hours?
Start today.
Like how many hours should we go with the preparations? So these were the questions being asked, ma'am.
At least about 7 to 8 hours in a day consistently. It is going to be very difficult in the beginning for somebody who cannot sit down for 7 to 8 hours. But remember, it takes only 21 days to cultivate an habit, and after 21 days, you will not even know the difference. So the first 21 days, you're going to have a little demotivation. You might get up the next day clouded. You're not in the mood. But you have to trick your mind, and the way to trick your mind is don't let your mind think. Just do it. Count till 5 and just do it. Go ahead and start.
Okay. Yeah, very well said, ma'am. Thank you so much. And ma'am, coming to the end of the live session, so you have been uploading. So currently, you have an YouTube channel where you upload
Yes.
videos. Like
Right.
some of your famous videos are 3-minute learning facial arteries and
Yes.
nerves, and you have come with some endodontic topics also in your YouTube channel. So
Right.
currently, in
Right.
your Instagram profile, you are giving MCQs for the oral pathology. So you're currently
I am
concentrating
giving
on the oral
institution.
pathology MCQs. So daily it's being very helpful for me personally. So I just learn and just brush up certain concepts. So that's just like provoking our minds to think, ma'am, beyond the textbooks. So it's very helpful. So what will be your future plans, ma'am? So what are you going to come up with? So are you coming
So
up with any
currently, I'm working extensively on making oral pathology and oral medicine lectures. Now,
Okay.
the way I have made these videos is that I have sat down with 4 or 5 books. I've sat down with a lot of videos. I've collected all the important information that you need to know about one topic. For example, leukoplakia or lichen planus or be it salivary gland tumors, whatever it is. And I have made it into small videos. Now, this videos will give you all the information that you need to know about that topic, and also it will give you a lot of MCQs, extra MCQs apart from dental parts. So nobody has to go search anywhere and waste their time in just aggregating information. All they need to do is set aside some time of 30 minutes a day and watch the video. So first of all, it's a very effective learning technique because you're just watching and interacting and learning and listening to somebody else. You're not reading, and somebody else is explaining it to you. Plus, they're giving out an information to you from various textbooks, so you're a step ahead from other people because they're reading from one book and you're getting all the information from 5, 6 books in one place. And all the important things that you need to know and what has been asked in the exam, the ratios, this has been asked. Which gene is involved in some diseases? It has been asked, but it's not mentioned in many of the books. So things like this, I'm starting to prepare, and I've already been halfway, and it's halfway ready. So if anybody is wanting to go ahead and take that from me, they can always DM me, and I'm ready to start it with them and help them out in the
So
best way possible.
Yeah, for further updates, you can contact ma'am through our Instagram ID, or else you can follow our YouTube channel for further videos.
I
You can
also see
also
a
DM us if
question.
you have any
Somebody
doubts.
asked us to suggest a standard books for NEET
Yeah, ma'am.
preparation. So what I will do is I will make a post for it and post it on my Instagram, and people can have a look of which are the standard books to study and which you can refer, and where the questions are mostly asked from.
I think for the each subject also they should be having a standard book, right? For like if for
I'm sorry?
anatomy they will be having as BDs or Russia. No, ma'am. Other than the exam preparatory books, like dental pulse and dentist, so they'll be for each like for the first year we would have studied in anatomy, we would have studied in a standardized book. So
Yes.
I think it's better to refer from standardized textbooks.
Yes, it's basically the same textbooks that you have studied for your BDS, all the 4 years. Majorly the same textbooks. It's just probably 1 or 2 textbooks here that you will have to add in.
So
And
that's more than enough. So you do.
and I would advise people not to go ahead and start anything new and just reinforce what you have studied in all the 4 years. That will be a much better approach than starting some new textbook.
So correctly said, ma'am. Well said, actually. Ma'am, so to conclude our live, so what is the final thing you wanted to tell to all the NEET aspirants and all the people who have been working so hard, who have been
So my
studying and
final
who are
advice
yet to
is
start their preparations?
right is first of all remain calm, sleep well, keep positive energy, positive thoughts in your mind. That is very important, and it's all about the mind. It's how you make your mind work for you is the way you will succeed in life. And this is just an exam. It's nothing that's going to decide your life or your career forever. Take it like an exam, prepare it like an aim, and study well. Be focused. Don't let negative energy surround you from anywhere. So just be focused and just keep doing. Take a good amount of breaks in the middle. Keep good energy. That's all about it. And we are always there. You can always contact me if you need any kind of information or any kind of help.
So thank you so much, ma'am. We have come to the end of the live session. So I need to personally thank you for joining us today. So in spite of your busy schedule and you were very busy with all your work and you had allotted your time when you come live and you have enlightened a lot of people, including me personally. So thanking you very much from the bottom of my heart for
Thank
all
you
your
so
efforts
much.
you're doing and for all your words, ma'am. It was a very helpful session personally, and it was like a very motivational and also a very big boost to us. to crack our NEET MDS. So thank you very much, ma'am, for joining in this live
Thank you,
session.
thank you. I'm very glad I could come here and share my experience, and I am always available for any kind of help that is needed, and I'll always be open to share my experiences.
Thank you very much, ma'am. Thank you so much.
Thank you, and all the best for all the NEET
Take care.
aspirants.
Thank you so much, ma'am. Thank you.
Thank
Very
you,
helpful, ma'am. Thank you.
thank you.
Thank you. Goodbye. Take care. Take care.
Goodbye. Take care.